So we come into Plan A today. What do we need to do to make sure that we can stay in Plan A?
Well, thanks to our world-beating vaccination program, today we're able to return to Plan A, and we're able to do that as a country because of the phenomenal success of our booster program. We're the most boosted country in Europe thanks to the NHS and pharmacies like this, and the millions of people that came forward. Over 90% of over 50s boosted, as I say, the most boosted in Europe, and it's because of that we're now able to begin a new chapter. We see Omicron in retreat, and we begin the road of trying to find all the best ways to learning to live with COVID. And today I'm particularly pleased to announce that we'll be removing a huge number of restrictions that were put on care homes during the Omicron crisis, and from Monday care homes will be able to have unlimited number of visitors, and we'll also be significantly cutting the self-isolation period. And again, we're able to do all this because of the success of our vaccination program, and I would just urge everyone who still hasn't come forward for whatever reason, for whether it's their first jab, their second or their third, please do come forward, protect yourself and your community.
There are obviously concerns from care homes that you're now opening up the floodgates to them with today's relaxing restrictions, where people are going to be able to come and visit, but they're concerned that they still have staffing shortages, that they still Omicron is still in the community. They're concerned that you're opening the floodgates.
Look, care homes have done a phenomenal job throughout the pandemic. It's been incredibly challenging, especially as we've seen over the last couple of months. And we work very carefully and closely with care home, the managers, the owners, to try and make them as safe as possible. And it's always about getting the right balance between making sure visitors can come and people can be properly looked after, but also that the patients and people in care homes are as safe as possible. And I think what we've announced today, which are these changes around visitors and cutting self-isolation periods, is the right balanced and proportionate approach.
Can care homes create and follow their own guidance that differs from government advice if they feel that the rules aren't enough?
At the local level, there is a lot of discretion, and I think that is right because one care home may have, for example, a lot of positive cases, another may have none. So there's a lot of discretion given to the managers of care homes, and they will work with their local public health officials in that region. And it's right. And nationally, though, we will provide the guidance and anything else they need, such as all the testing, tests that they might need, whether it's PCR tests, a lateral flow test, and any other support that they need.
What do you say to people that are concerned that their local care homes might decide to make their own guidance and not allow visitors when they haven't seen their families in a huge amount of time? What do you say to them that they're concerned that local care homes might create guidance that contradicts what you?
I would just urge all care homes to do everything they can to allow as many visitors as they can. Now, as I say, from Monday, in terms of national rules, there will be no restriction on the number of visitors. If a care home needs to act a bit differently because of an outbreak, then that is understandable, as long as they are doing everything they can to allow the maximum number of visitors.